Whether you will be working in a long-term care facility, a hospital, an assisted living facility, or in a client's home, you will be working with people. And it's important to understand human beings and their needs, especially as they age and go through challenging times in their life. Hi, I'm Barbara Harris, nursing assistant instructor and part-time social worker. And for those of you who may not be familiar with the role of a social worker in a long-term care facility, that person is responsible for admissions to the nursing home, new residents coming in, discharge planning, and meeting the social and emotional needs of the residents who live in that facility. Today's topic is human behavior, and we will be discussing the teachings of a couple of leaders in the field of human behavior, Erik Erikson and Abraham Maslow. And these two people have helped us to understand human needs and how people go about meeting those needs. A person goes about satisfying their personal needs in a way that reflects their personality. You can define personality as the way that we react to the events in our lives. Erik Erikson suggested that our personalities are formed from the moment we are born as we mature all the way through old age. He defined 8 different stages of maturity going through life and called these the tasks of personality development. First of all, the first stage as a newborn, an infant is in the oral sensory stage, during which time he must learn to trust. And if that infant's caregiver is consistently there to meet that infant's needs, he will learn to trust that that caregiver will always be there to meet those needs. But if the caregiver is inconsistent in meeting those needs, Erikson believed that that infant will grow into a person who probably has lifelong issues learning to trust people. The second stage of personality development is muscular anal stage. As a toddler, the child begins to recognize himself as an independent being from his mother, or autonomy. The toddler is no longer completely dependent upon his mother for survival. The next stage of personality development is locomotor stage during the preschool years. A child is then beginning to recognize himself as a family member and taking some initiative, beginning to learn to do simple tasks, to dress himself, for example. The next stage is called latency. School age years covers this stage, and this is when a child is beginning to demonstrate physical and mental skills and abilities. Erikson called it industry, when the child is first learning to read and do math in school, for example. The next stage is adolescence, and this covers from 12 to 18 years of age. And this is when a young person first begins to develop a sense of individuality as a sexual human being, and develops their identity and first becomes aware of an attraction for others. The next stage of personality development is young adulthood. This covers the years from ages 19 to 35. And this is when people begin to establish an intimate personal relationship with a mate. Intimacy is the goal, the issue of this stage in life, when people begin to find a mate, perhaps get married, have children. The next stage is adulthood. These are the years from 35 to 50 years of age, during which time Erickson says the person will be learning to live a satisfying and productive life. This is the stage of life when people perhaps have children at home yet, and maybe also have parents who are aging that sometimes they are also caring for their elderly parents. That is called the sandwich generation. Some people in this age group have this type of an issue. The final stage of personality development is maturity, and Erickson called this 50+ years of age, during which time a person reviews their life's events and examines how they've influenced the development of their individuality. Ego integrity, he called it, meaning that if a person has regrets or issues from earlier stages in their life, they will still be a part of their individuality and perhaps still be issues for them in their old age. Abraham Maslow described to us that human needs are physical, psychological, and sociological. He placed these needs on a continuum in which the physical needs had to be satisfied first. The psychological or sociological needs can be met only after the physical needs are met. He called this the hierarchy of needs. And at the bottom of this hierarchy of needs is the most basic level. The first level is physiological or survival needs. And these are the basic physical needs that all of us have as human beings, and for which you will be providing when you care for your clients. This includes oxygen, all people breathe, food, everyone needs nutrition, and you provide that according to their specifications. Water, all human beings need fluid, shelter and clothing. You need to keep your clients protected from the extremes of temperature. Elimination of wastes. You are going to be assisting your clients with toileting and trying to prevent incontinence and constipation. Sleep. You provide for rest periods for your clients with naps and sleeping at night. Activity. You will provide for activity for your client with involvement in activities, in exercising, walking, for example. And Maslow maintained that all of these needs in the basic level of the hierarchy must be met first before a person can begin to address their needs on the next level up, and that is safety and security needs. You also will be providing the safety and security of the clients that you care for. You will provide for the physical safety of your clients. When you are walking down the hall, for example, if you see a water spill on the floor, please stop and clean it up in order to prevent an accident. If you hear an alarm, a chair alarm, for example, indicating that a client is trying to stand up and needs assistance, stop what you're doing and attend to that alarm immediately, and in order to provide a safe environment for your clients. Use restraints properly and according to the doctor's orders for each of your clients. Know what to do in case of an emergency in your facility. If you hear the fire alarm, do you know what to do? If you don't, find out. You can prevent the spread of infection to your clients when you maintain standard precautions, washing your hands and gloving at the proper times and in the proper procedure in which you were taught. You will assist your nurse in monitoring the physical health status of your clients, as you take care of them and become aware of any changes, you will see things that your nurse does not see. And be sure to be reporting those immediately to your nurse to maintain a safe and healthy environment for your clients. You also provide an environment of emotional safety for your clients. And this means simply speaking to your clients in a compassionate way, in having patience with them. Remember, you will have times that you become frustrated. You will be stressed out. But you cannot express that frustration to your clients in your tone of voice. You want to always speak to your clients in a gentle tone of voice, and sometimes this is something you need to learn how to work through your frustration so you can express yourself in a gentle way to your clients at all times. You want to honor your clients' rights to make choices, even if you don't agree with them. If Mrs. Smith wants to wear an outlandish outfit one day and you think it's horrible, it's not your opinion that matters, it's hers. And you must honor her right to make that choice. Once all of the needs in the safety and security level of the hierarchy have been met, a person can then move up to the next level in the hierarchy and begin to address the needs of belonging and love. If you are working in a long-term care facility, your clients have an especially high need to feel that the place that they live in is their home. Especially clients who are new and don't feel that way at all. You have the power to help them, make them feel as if where they live is indeed a home. You can advocate for clients who are at first hesitant to ask for the things that they want, little things that you can bring to them or do for them. If they are shy to speak up for themselves, be sure to validate them, encourage them to speak up for themselves, and tell them it's okay and that you would be happy to do whatever you can do for them to make them feel more at home. And tell them, this is your home and I'm here to make you happy. Be consistent. Find out the personal preferences of your clients. And not only follow through on them every time that you care for them, but tell your coworkers about these things so that when they go to care for that client, they can also meet those extra special requests of that client and make them feel as if they are in a place where they belong. You want to always treat your clients with unconditional positive regard. This means that even if your client becomes verbally abusive or even physically abusive to you, now you already know you cannot return that same behavior to them. You must always treat them with patience and compassion and use a gentle tone of voice. But remember that you will be dealing with them long term, probably, as your client. Don't hold a grudge. Always treat them with the same compassion, even if that incident had not happened. Don't hold it against them. You want to be sensitive to the issue of sexuality in geriatric clients. Some of your clients may still have a desire to be alone with another client, and they do have that right if there are two consenting clients. And if you have concerns over this, you certainly want to be consulting your nurse on this. But remember that they have a right to privacy. And also remember, if a client is acting out toward you in a sexually inappropriate manner, just remember that they are expressing a basic human need, and it's not personal. And again, consult with your nurse on how to deal with that client and that behavior. You want to address your clients by the name or the title that they prefer to be called. If a client of yours really prefers to be called Mrs. Jones, for example, she will probably feel just a little bit slighted if you would call her by her first name after she's told you she'd prefer not to be called that. So remember those things when you're speaking to your clients. Now, the next level up on the hierarchy of needs is self-esteem. And Maslow taught us that once the middle level of the hierarchy has been met, a person can then move up to this level of self-esteem and begin to address these needs. Remember that your clients have a need to feel self-worth just the same as you do. You can promote your clients' individuality when you offer them choices, and try to always offer choices with everything that you do. The little things really matter. As opposed to walking into a room and asking Mrs. Jones if it'd be all right if we do her bath right now. Instead of that, approach her at the beginning of your shift and ask her, well, what time would you like to do your bath? Give her a little power and to make that decision for herself. Assist your clients to look good with dressing and with grooming according to their own preferences. Help your clients feel important. Talk to them as if they are just as important to you as your own loved ones are. Ask for their opinions. Discuss current issues, things in the news, for example. Encourage their socialization. Encourage them to get out and talk to other residents. Once all self-esteem needs are met adequately, a person may find themselves moving up to the top level of the hierarchy, which Maslow says doesn't always happen in people. But it pertains to self-actualization or creativity needs that people have. And your clients may very well continue to have a need to be the best person that they can be, just as you do, and to be creative. You can encourage their independence when they are caring for themselves. Encourage them to do as much for themselves as they can, as opposed to you doing it for them every time. Advocate for them to do their personal hobbies if you hear them mention that they used to do a certain hobby. I remember one of the clients in our long-term care facility, when she first came to the nursing home, she told me she thought since she was in a nursing home she couldn't do the same things anymore, and so even though she had a lifelong hobby of crocheting, she turned over all of her yarn to the activity director. She thought since she was in a nursing home she couldn't do that anymore. And then as a few weeks went on, well, she didn't have anything to do, and a few people encouraged her to try crocheting again and asked her, why can't you still do it? She asked for the yarn back, and now she crochets all day, every day, and makes a lot of items for different people. And it's really kind of become her identity for herself, and she's really proud of what she does. You want to respect people's differences in values, beliefs, religion, and culture. There are many different factors which influence a person's response to everyday situations. There is a theory called nature versus nurture. Nature referring to the genetic background into which you are born, which you cannot change. And nurture refers to the environment that you were brought up in and how you were raised and things that you learned as you matured. And the nature versus nurture theory implies that a person's personality is a reflection of both of those influences working together. Cultural background can also determine a client's personality, their attitude toward their health. Cultural expression can help a person feel more comfortable in their surroundings. And this expression can be in the form of ethnic, music, art, food, holiday celebrations. Clients practice different religions. They have a right to participate in the religious activities of their choice. Religious beliefs can provide support. Expression and participation of those religious beliefs is to be encouraged and supported by you. When a person's physical needs are not being met, the results are noticeable. A person can become dehydrated, lose weight, obtain an infection of some type and become ill. Infection and accidents also may occur when safety needs are not met. The results are not as obvious many times when the psychological needs are not being met. And as a caregiver, you will experience many times when you see a behavior in a client that you don't understand. Perhaps they are acting out in some way that seems threatening. And most times, remember, it's not personal, probably not personal at all or directed toward you, but rather an expression of a need. All behavior is purposeful, even if we never know exactly the reason why. All behaviors that people do have a reason, have a motive, and many times it's an expression of an emotion, depression, fear, anxiety. It could be anything. Could also be a subtle indication of some type of illness. When we see clients in the long-term care facility who suddenly become confused, we start thinking infection. What type of infection might they have? So remember this when you see behaviors in your clients that you don't understand. Because as a caregiver, you play a major role in helping your clients meet their needs. You will need to understand those needs, and in every interaction with them, try to help them meet those needs. When you understand human behaviors and the different levels of needs for all people, you can better satisfy those needs and improve the quality of care.